You know that feeling, right? You hear a medical term, maybe from the vet, or you see something online,
Hmm.
like cerebrovascular accident, and your mind just sort of spins. Maybe it came up with your own pet.
It definitely sounds serious, and, well, it can be. It's a term that grabs your attention.
For sure. So that's what we're diving into today.
Exactly. We want to cut through some of that jargon.
Right. Think of this as getting straight to the point. We've looked at a solid medical reference source on cerebrovascular accidents, CVAs, or what most people just call strokes.
Specifically in dogs and cats, yeah.
Yeah, dogs and cats. The goal is to pull out the essentials, what they are, why they happen, how you spot them, and what can actually be done.
Without the information overload, hopefully. Just the core stuff.
Exactly. We want clarity, not confusion.
Okay.
So picture the brain. Super complex, needs constant blood flow.
Absolutely vital.
Now, imagine a plumbing issue in that system. That's kind of the simplest way to think about a CVA.
That's a great analogy.
It's either like a pipe gets clogged, that's your ischemic stroke,
The blockage type.
or a pipe bursts, causing a leak, the hemorrhagic stroke.
Right. Both mess up that critical blood supply.
So let's get a bit more technical then. What's the actual definition of a CVA?
Okay, so technically a CVA is defined by a sudden onset of brain signs. Signs related to a specific area, usually.
Correct at an onset.
And crucially, these signs don't keep getting worse after the initial event, but they do last longer than 24 hours.
Ah, longer than 24 hours. That implies.
It usually implies some permanent damage has occurred to the brain tissue.
Okay, and how's that different from a TIA? I've heard that term too.
Right, a TIA or transient ischemic attack. That's where the signs do resolve within 24 hours. It's more like a temporary disruption, not typically causing permanent damage.
Got it. So CVAs mean lasting effects, potentially.
Potentially, yes. And they stem from underlying issues with the brain's blood vessels, cerebrovascular diseases.
Okay, so let's break down those two main types you mentioned. Ischemic first, the blockage. What's happening there at the vessel level?
With an ischemic stroke, an artery supplying blood to a part of the brain gets blocked abruptly.
Blocked by what, usually? A clot?
Often a clot, yes, or sometimes other material. But the result is the same. That area of the brain is suddenly deprived of oxygen and glucose.
The fuel it needs to survive.
Exactly. So the brain cells in that region start to malfunction and eventually die if the blood flow isn't restored. It's basically tissue starvation.
Okay. And the other type, hemorrhagic, that's the bursting pipe analogy.
Right. In a hemorrhagic stroke, a blood vessel actually ruptures. It breaks open.
And blood leaks out.
Yes, causing bleeding either directly into the brain tissue itself or into the space surrounding the brain.
Which sounds bad either way.
It is. The leaked blood can directly damage brain cells, and it also increases pressure inside the skull, which causes further problems.
So one is about lack of blood flow. The other is about blood being where it shouldn't be.
That's a good way to put it.
Now, who gets these? Is it common in pets?
Well, the exact numbers. We don't really have them for dogs and cats. It's generally thought to be less common than in humans.
Okay.
But we definitely see it in both species. And interestingly, for ischemic strokes, there seem to be some breed connections in dogs.
Oh, really? Like which ones?
Cavalier King Charles Spaniels and Greyhounds pop up as being more predisposed.
Huh. Interesting.
And there's even a possible link to size and where the stroke occurs. Smaller dogs, say under 15 kilos, might be more prone to infarcts in the cerebellum.
The back part of the brain, coordination center.
Right. Whereas larger dogs, over 15 kilos, might be more likely to have them in the midbrain or thalamus area.
Wow, that's specific. What about hemorrhagic strokes? Any breed link there?
Not that we know of currently. For
Okay.
hemorrhagic, breed, age, sex, none seem to be clear predisposing factors based on what we know now.
Okay, so if this happens, what would an owner actually see at home? What are the signs?
It can vary a bit.
Yeah.
For ischemic strokes, the signs usually come on very suddenly peracute, we call it.
Like, bam, something's wrong.
Pretty much. And typically, the signs are focal, meaning they relate to one area of the brain and they don't worsen after that initial hit.
Okay. And hemorrhagic.
Hemorrhagic can also be sudden or maybe slightly more gradual, acute to subacute. The signs might be focal or more spread out, multifocal.
And you said they might get worse.
Yes, that's a key difference. Hemorrhagic stroke signs can sometimes progress or worsen over a short period, maybe hours, likely due to ongoing bleeding or swelling.
That must be frightening to witness.
It certainly can be.
So the pet gets to the vet. What might the vet pick up on during the initial checkup, the physical exam?
A good physical exam can offer clues. Looking in the eyes, the fundus exam.
Right, the back of the eye.
Yeah. They might see things like tortuous, twisty blood vessels, which could suggest underlying high blood pressure hypertension.
A known risk factor.
Definitely. Or they might see actual hemorrhage, bleeding in the back of the eye.
Yeah.
That could point towards hypertension again, or maybe a problem with blood clotting, a coagulopathy. Sometimes swelling of the optic nerve head, called papilledema, can be seen, suggesting increased pressure inside the skull.
And other general signs.
Yeah, if the vet finds evidence of bleeding problems elsewhere, like bruising or pale gums suggesting anemia, that might lean towards a hemorrhagic cause linked to a clotting issue.
So the physical exam points towards potential systemic problems that could be involved.
Exactly. It helps build the picture.
Then comes the neurological exam. How does that help narrow things down?
The neural exam is all about localization, figuring out where in the brain the problem is.
Makes sense.
With an ischemic stroke, the specific neurological deficits may be weakness on one side, wobbliness, circling, changes in alertness, seizures.
Right.
Those signs will depend entirely on which blood vessel got blocked and which part of the brain it supplied. Could be the forebrain, midbrain, brainstem, cerebellum.
So the location dictates the signs.
Precisely. For hemorrhagic stroke, because it often causes that increased intracranial pressure.
The pressure inside the skull we mentioned.
Yes. The signs might be a bit less specific to one location. You might see more general signs pointing to forebrain disturbance, like changes in behavior or seizures, and/or brainstem issues like balance problems or changes in consciousness.
Okay, so ischemic tends to be more focal based on vessel territory. Hemorrhagic maybe a bit more diffuse due to pressure.
That's a reasonable generalization, yeah.
Right. Let's really dig into the why, the underlying causes. This seems like the core of it. Let's start with ischemic stroke in dogs again. You said sometimes it's unknown.
Yeah. Frustratingly, in maybe up to 50% of cases in dogs, we don't find a definitive underlying cause. It's termed idiopathic.
Wow, half. But when a cause is found.
We see associations with several things. Endocrine diseases are big ones like Cushing's disease, which is hyperadrenocorticism,
Right.
hypothyroidism, and diabetes mellitus.
Hormonal imbalances affecting blood vessels or clotting, maybe?
Potentially, yes.
Uh,
Then there's embolism or thromboembolism. That's where a clot or other material travels from elsewhere in the body and lodges in a brain artery.
where would that stuff come from?
It could be from tumors, like the aggressive cancer hemangiosarcoma
Mhm.
or lymphoma. It might be infectious, breaking off from infected heart valves, bacterial endocarditis,
Okay.
or clots forming in the heart, or major arteries like the aorta. Systemic hypertension, high blood pressure is another major one.
Often linked to kidney disease.
Yes. Chronic kidney disease is a common cause.
Yeah.
Also, protein-losing conditions affecting the gut or kidneys.
Anything else for dogs? Less common causes.
There are rarer things, like fibrocartilaginous embolism, FCE, though that usually affects the spinal cord more often, intravascular lymphoma, even parasite migration, like Cerebrovascular larvae.
Ew.
Yeah. Or pieces of heartworm, Dirofilaria amitis, embolizing.
So quite a list for dogs, even if half are unknown. What about ischemic causes in cats? Similar.
Some overlap, some differences. Parasite migration, Cerebra again, and heartworms are known causes in cats too.
Okay.
Systemic hypertension is significant in cats, often secondary to other common feline issues like hyperthyroidism.
Overactive thyroid.
Right. Or chronic kidney disease
Yeah.
or heart disease. And, like dogs, emboli traveling from tumors can also cause ischemic stroke in cats.
Got it. Now let's flip to hemorrhagic stroke. The bleeds. What causes those in dogs?
In dogs, causes can include ruptured congenital vascular anomalies, basically. Blood vessels that didn't form correctly from birth.
Like a weak spot bursting?
Kind of, yeah. Brain tumors, both primary ones starting in the brain and secondary ones that have spread there, can bleed.
Okay.
Inflammatory diseases affecting arteries or veins of vasculitis. Intravascular lymphoma, again, a specific type of stroke called brain hemorrhagic infarction, and critically, problems with blood clotting, impaired coagulation.
Right. If the blood can't clot, bleeding won't stop.
Exactly.
And for cats, hemorrhagic causes?
Pretty similar list in many ways. Primary and secondary brain tumors, vasculitis, brain hemorrhagic infarction. Impaired coagulation is also a factor. And sometimes in older cats, a condition called cerebral amyloid angiopathy can weaken blood vessels, making them prone to rupture. And again, systemic hypertension is a key cause of hemorrhagic stroke in cats too.
Man, hypertension just keeps coming up, doesn't it?
It really does. It's a major player in both types of stroke, in both species.
So are there other sort of general risk factors then, besides hypertension?
Well, for ischemic stroke, besides hypertension, any condition that makes the blood stickier or more prone to clotting.
Coagulability.
Exactly, hypercoagulability. That increases the risk that Cushing's, kidney disease, losing protein, certain cancers,
Okay. And for hemorrhagic?
hypertension, as we said, and then anything that impairs clotting coagulopathy. That could be inherited bleeding disorders, liver disease, since the liver makes clotting factors, certain toxins like rat poison.
Gotcha. So systemic health is really tied into brain vessel health.
Absolutely.
Now, if a vet suspects a stroke, what else could it be? What are they trying to rule out?
Good question. Differential diagnoses are important. Head trauma is an obvious one to consider, though history usually helps there.
Right.
Brain tumors can cause sudden signs if they bleed or swell rapidly, but often they cause more gradual, progressive signs, unlike the typical CVA picture.
Okay, so the timing helps differentiate.
Often, yes. Infectious or inflammatory brain diseases, like encephalitis, also tend to worsen more gradually, and certain toxicities affecting the nervous system need to be considered, though they often cause more symmetrical, widespread signs.
Okay. So ruling those out is part of the process. Then the actual diagnostic toolkit. What tests are run? You mentioned blood work.
Yeah, standard blood tests, CBC, chemistry panel, and a urinalysis are usually baseline.
Are they often normal in stroke cases?
They can be, especially if it's, say, an idiopathic ischemic stroke, but they're crucial for finding those underlying diseases we talked about. Kidney disease, liver issues, signs of Cushing's, diabetes.
So they check for the why.
Exactly.
Are there more specialized lab tests?
Yes. Analyzing cerebrospinal fluid, the CSF fluid around the brain and spinal cord.
A spinal tap.
Right.
Mm.
That's mainly done to rule out inflammation or infection like encephalitis.
Yeah.
In stroke cases, the CSF might be normal or show only mild, non-specific changes.
Okay. What about clotting tests?
Definitely important, especially if hemorrhagic stroke is suspected or if you're looking for hypercoagulability with ischemic stroke. Tests like PT, APTT, maybe bleeding time.
Measuring clotting ability.
Yes. And more specialized tests like thromboelastography or D-dimer assays can sometimes help assess the risk or presence of abnormal clotting. And of course, endocrine testing thyroid levels, tests for Cushing's, and checking kidney function.
Lots of lab work to search for clues. But to actually see the stroke, that's imaging, right?
That's where imaging is really king, is the gold standard.
CT or MRI? Or both?
Both have roles, but MRI is generally considered superior for viewing brain tissue changes in stroke.
Why is that?
Especially for ischemic stroke, a CT scan might actually look completely normal in the first few hours after the event.
Ah, so it could miss it early on?
It could. MRI, particularly if done within, say, 12 to 24 hours, is much more sensitive to the early changes of infarction, the tissue damage from lack of blood flow.
What does MRI show?
Different MRI sequences give us different information. T2-weighted and FLAIR sequences are good at showing areas of swelling or fluid. T2-weighted sequences are incredibly sensitive for detecting blood.
Useful for both types, then?
Absolutely. DWI, diffusion-weighted imaging, is excellent for highlighting very recent ischemic damage. And things like perfusion MRI can assess blood flow, while MRA, magnetic resonance angiography, looks directly at the blood vessels.
So MRI gives a really detailed picture. What about CT for hemorrhagic strokes? You said T2 MRI is good for blood.
CT is actually very good, very sensitive for detecting acute hemorrhage, fresh bleeding.
Oh, okay. How does that look?
Fresh blood appears bright white, hyperdense on a CT scan, making it quite obvious. The appearance does change over days and weeks as the blood breaks down.
So CT is good for spotting a bleed quickly.
Yes. MRI is also very useful for hemorrhage. And like CT, the appearance on MRI changes depending on how old the bleed is. That T2 sequence we mentioned is great because it shows blood as a dark spot, regardless of age.
Can the pattern of bleeding give clues?
Sometimes, yes. Finding lots of tiny little bleeds, less than 5 millimeters, might point towards underlying hypertension, or maybe Cushing's or kidney disease. A single larger bleed might make you think more about things like a tumor, or maybe a specific parasite like Angiostrongylus in dogs.
Fascinating how imaging can provide so many clues.
It's incredibly powerful for diagnosis and guiding further investigation into the cause.
So we've got the diagnosis, maybe an underlying cause identified. Let's shift to what's happening right down at the cellular level. What does the brain tissue actually look like after a stroke, pathologically speaking?
Okay. In an ischemic stroke, you see what's called ischemic necrosis cell death due to lack of oxygen. It's usually centered in the gray matter, which is more metabolically active and vulnerable.
Gray matter being the nerve cell bodies.
Right. The lesion, the damaged area, tends to be sharply marked off, limited to the territory supplied by that one blocked artery. Usually there isn't a huge amount of mass effect, or swelling initially.
For some brain areas hit harder?
Yes, there's selective vulnerability. The cerebral cortex, the hippocampus involved in memory, basal nuclei, thalamus, and the Purkinje cells in the cerebellum, these seem particularly sensitive to oxygen deprivation.
What changes happen over time?
Early on, cells swell. Later, you see tissue loss, atrophy, new blood vessel formation trying to compensate, maybe, and infiltration by special cleanup cells called Gitter cells, which are a type of macrophage.
Okay. And for hemorrhagic stroke pathology?
There, the primary event is bleeding into the brain tissue at the parenchyma, typically from small arteries rupturing. Acutely, you see the fresh blood mixed with dying neurons.
And then?
Over time, macrophages move in to clear up the blood and debris. This process can eventually lead to a cystic cavity forming where the tissue was destroyed.
Is there swelling?
Yes, significant edema, swelling, is common around the hematoma, the blood clot. You also see damaged neurons and inflammatory cells like macrophages and neutrophils in the surrounding tissue.
Does the bleeding always stop?
Not always.
Yeah.
Some bleeds are self-limiting, but others can unfortunately continue to expand, either from ongoing rupture or secondary bleeding from damaged vessels nearby. The blood can also track along white matter pathways.
It really paints a picture of significant disruption.
It absolutely is.
So knowing all this, what can actually be done? What are the treatment approaches once a pet has had a CVA?
The first, absolutely crucial step is identifying and treating any underlying disease that might have caused it. Hypertension, Cushing's, kidney disease, whatever it might be.
Manage the root cause.
Yes. Alongside that is supportive care. This is paramount.
What does that involve?
Ensuring good oxygenation, managing complications like seizures or aspiration pneumonia if they occur, maintaining hydration, providing nutritional support if needed, and good nursing care, keeping them clean, comfortable, turning them if they can't move well.
Okay. Is the nursing care different for ischemic versus hemorrhagic?
The principles are similar, but there are some specific focuses. For ischemic stroke, we monitor vital signs closely: oxygen, temperature, hydration, blood pressure.
What about blood pressure specifically? Lower it.
Carefully. You generally want to maintain adequate blood pressure to ensure the brain gets perfused, especially the areas around the infarct that might still be viable. So aggressive lowering is usually avoided unless it's extremely high, like dangerously high.
Any specific drugs for ischemic? Like steroids?
There's currently no strong evidence that glucocorticoids, steroids, are beneficial for ischemic stroke in pets, and they can have side effects. Many neuroprotective agents have been tried but haven't shown consistent, proven benefits in clinical use.
Okay. What about nursing care for hemorrhagic stroke?
The initial focus there is stabilization. ABCs, airway, breathing, circulation, monitor vital signs very closely. Neurological status needs frequent checks for any deterioration.
Because of the risk of ongoing bleeding or swelling.
Exactly. Identifying and treating the cause of the bleed is critical. And managing that potential increase in intracranial pressure is a major goal.
How do you manage the pressure?
That involves things like ensuring proper hydration, but avoiding fluid overload, sometimes specific medications, and addressing any mass effect from the bleed itself. The first 24-72 hours are really the highest risk period for worsening.
Are there specific medications used during the stroke event itself?
Well, for ischemic stroke, if hypertension is severe and needs addressing, antihypertensive drugs like ACE inhibitors in the lateral benaceprol or calcium channel blockers like amlodipine would be used cautiously.
Okay.
If there's a high suspicion of a clot coming from the heart, say an embolism, then preventative antiplatelet therapy like low-dose aspirin or clopidogrel might be started once the patient is stable to reduce the risk of another clot.
And if they have that hypercoagulable state?
Low molecular weight heparin might be considered in some cases to reduce clotting risk.
And for hemorrhagic stroke, any specific meds? Besides managing blood pressure if it's high.
The main one considered specifically for the bleed itself is mannitol.
What does that do?
It's an osmotic diuretic. It can help draw fluid out of the brain tissue, reducing swelling and intracranial pressure. But it's usually reserved for cases with clear signs of dangerously high ICP that aren't responding to other measures. It has to be used carefully.
So treatment is really about support, managing underlying issues, and addressing the specific complications of blockage versus bleed?
That sums it up well.
What about follow-up? What happens after the initial crisis?
Close monitoring continues, especially frequent neurological exams over the first, say, 48 to 72 hours to track improvement or watch for any decline.
Are there common complications later?
For ischemic stroke, the main concern is recurrence. another stroke happening, especially if an underlying cause isn't found or managed effectively.
What's the expected course usually? Do pets recover?
For ischemic stroke, typically the neurological signs are worst within the first 24 hours. After that, gradual improvement is often seen over the next few weeks, maybe even up to 10 weeks.
Do they get back to normal?
Many improve significantly, but some degree of permanent neurological deficit can remain. And as we mentioned, if there's an underlying condition still present, the risk of relapse is higher, and overall survival time might be shorter.
What about prognosis if the whole brain was affected, like after cardiac arrest, global ischemia?
That's much harder to predict, honestly.
Yeah.
We lack large controlled studies, so prognosis is often guarded in those situations.
Okay. Let's try and wrap this up then. We've covered a lot of ground on CVAs, strokes, in our pets.
We certainly have.
We've got the two main types down, ischemic, the blockage,
Mhm.
and hemorrhagic, the bleed. And we know they stem from issues with the brain's blood vessel.
Right. And driven by a whole range of underlying causes.
Yeah, that was eye-opening. From high blood pressure, which came up again and
A
again,
big one.
to hormone issues like Cushing's or thyroid problems, kidney disease, heart conditions, clotting disorders, even parasites sometimes.
It highlights how interconnected everything is.
Totally. And we saw how important diagnosis is, the exams, the lab work, searching for clues, and especially that advanced imaging MRI and CT to actually see what's happened in the brain.
Crucial for confirming the stroke and guiding treatment.
And the treatment itself, supportive care is key, managing those underlying conditions and specific approaches depending on whether it was a block or a bleed.
Trying to minimize damage and support recovery.
You know, what really stands out is how something presenting so suddenly, like a stroke, often isn't really that sudden in its origins.
That's a great point. It's often the endpoint of other ongoing health problems that finally manifest in the brain's vascular system.
Yeah, it really underlines the link between, say, cardiovascular health, endocrine health, and brain health.
Absolutely.
And even though we focused on dogs and cats, I think understanding these processes gives you, the listener, a better appreciation for brain health in general, right?
Definitely. It underscores why managing chronic conditions like hypertension or diabetes is so important, not just for the heart or kidneys, but for the brain too.
Makes you think about proactive care.
It does. And maybe encourages a deeper look into some of those conditions we mentioned, hypertension, Cushing's, kidney disease, to understand their full impact.
Good suggestion. And maybe a final thought to leave everyone with. Given how complex and frankly delicate the brain's blood supply seems to be, what other, maybe less obvious disruptions in the body could be having significant downstream effects on brain health that we just don't fully grasp yet?
That's a deep question. Or perhaps thinking about how often the cause remains unknown in pets. What does that really tell us about the limits of our current understanding?
Definitely something to mull over. Thanks for walking us through all that.
My pleasure. It's a complex but important topic.